The second part of question 23 was question 23b, which asked students to outline the reasons for the inequities experienced by Aboriginal and Torres Strait Islander people. So this question fed on from 23a, which was sort of the format of the HSC, how it's going to be going. From now on, there'll be a question which is going to build on from the previous one. So remembering in question 23a, we asked students for what the actual health inequities are. And then below in 23b, which one we're looking at right now, is we're asking the students to outline the reasons, and I'll even circle that so they can emphasise, outline the reasons for the inequities experienced by Aboriginal and Torres Strait Islander people. So what are the actual reasons behind the inequities faced by Aboriginal and Torres Strait Islander people? Again, we'll just have a look at our syllabus to get an idea where it's from. It's the same dot point. Groups experiencing health inequities, and the Aboriginal and Torres Strait Islander peoples would come under this one, this part here. Okay, so they're definitely a group experiencing health inequities. If we have a look at an answer here, so we're just looking here at this answer, and I'll go through and read out the parts because, again, it's a great answer and it really does highlight the reasons behind the facing of the inequities that they have. So, reasons for the health inequities experienced by Aboriginal and Torres Strait Islanders include living in rural or remote areas. Example, living in a rural remote area may provide difficulty in assessing health services due to distance. So we've got a reason and we've got an example to go with it. That's outstanding. Other reasons for inequities experienced by Aboriginal and Torres Strait Islanders include a higher level of alcohol intake, higher levels of smoking, higher levels of violence, and higher levels of exposure to hazards such as asbestos. Example, since more Aboriginal and Torres Strait Islander people smoke, the chances of developing CVD, cancer and respiratory disease significantly increase. And we can remember from our previous answer that higher rates of sickness and death in CVD or in smoking and in cancer rates was evident. And that's been supported here as a reason. This lowers the overall health of Aboriginals and is seen on a health inequity. Socio-economical status may also be low for the majority of Aboriginal and Torres Strait Islanders. This means that they will be unable to afford health services. Example, some medicines may be costly, and due to the low socioeconomic status, some Aboriginal and Torres Strait Islanders may not be able to afford it. Work hazards also contribute to health inequities. Example, some of them have long exposure to the sun due to their employment, and hazards such as asbestos, because of the low levels of education, increase health inequities by increasing levels risk of developing serious health conditions. Right, and as I've said here, my marking area, I've given him a 5 out of 5 to this student, which is outstanding. Very well done, a good answer. I like the way that he's included a number of examples to support what he was saying about the health inequities. Just some feedback again from our marking guidelines. From what I've looked at here is that I've already explained the difference between the health inequities and the reasons. What students needed to talk about here was that, some different areas. So they could have spoke about some of the social factors for reasons for health inequities, such as their location, their discrimination, some disadvantages in education, housing, income and employment. Some of the physical environment factors could have been mentioned as well as a reason. Also, lack of access to appropriate health services is another problem, which contributes to them having health inequities. Poor public health measures also have a negative effect on Indigenous health. So these are a series of reasons, which is what the question was asking for, that would lead to Aboriginal and Torres Strait Islander people having health inequities. Again, most students answered this question quite well. Again, I was impressed with the syllabus knowledge. Students were able to name at least 3 reasons and included a number of examples to support what they were saying. So it was very, very well done. A well answered question by, if not all, but most students.